living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Your oral health can often be a key indicator of what's happening with your overall health. In fact, an unhealthy mouth, especially gum disease, can lead to other serious health problems, including heart attack, stroke, and diabetes. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Today we'll be discussing oral health and the connection between your mouth, teeth, and gums to your overall well-being. Stay with us, we'll be right back. Welcome back. Joining us this morning is Dr. Daniel Wardell, a dentist who works at Pureview Health Center. Thanks so much for being on the show this morning, Dr. Wardell. So you work at a community health center, or CHC. Can we start out by just talking to folks a little bit about what a CHC is and what kind of services you provide?
Yeah, so community health center is a great place to receive comprehensive health care. In fact, most community health centers are called FQHCs, which means that they get a large portion of their budget from federal grants. That allows the health center to offer a lot of more services at lower costs or at discounted rates for patients, provide like something like sliding fee scales, or working with the patient on their ability to pay a bill afterwards.
Okay, and what are some of the services that someone could get from a CHC?
Well, so specifically, for our CHC through Pureview, we offer a variety of services. We have a full dental clinic, obviously, where we offer like basic, dental services. We have a full medical primary care center at our clinic. We offer behavioral health services. It's like the full gamut, I would say. Our clinic as well operates a clinic in Lincoln, Montana, and then also a school-based clinic in East Helena.
Okay, and you mentioned a sliding scale. What is that? So
a sliding scale is based on like I said, a lot of CHCs get their grants from the federal government. The federal government establishes guidelines as far as income level, and then the board of directors of a CHC typically review that every year and kind of come up with guidelines as to where a person's income level is based on their ability to pay. So once a patient comes in, if their income level is within a certain range, they can qualify for a discount of the services we offer, and that can up to include even a small fee of only like $20 for a service that's provided. Okay,
and so for those of us who haven't used a community health center before, what would you tell us about maybe looking into something like that?
Yeah, so like I said, they're a great place to receive comprehensive care, and they're run by people that typically either use the services themselves or are definitely part of the community in some way. The main kind of goal of a CHC is, and there's kind of the idea that all Montanans should have access to quality of care regardless of the ability to pay. Our clinic specifically, our motto is that we provide comprehensive health care with comfort. We talked about the sliding fee scales, the differences in payment. Also the fact that most people feel that or think that CHCs only serve the underinsured or those unable to pay. We do also serve all patients that have Medicaid, Medicare, or any other private insurance.
Okay, good. So that's good to know. So let's go ahead and shift gears now and jump into the dental health.
Sure.
Since that's what we're here to talk about today. So are there certain things that happen to your teeth, your gums, that just happen with age?
Yeah, like anything, as we age, there's a certain amount of wear and tear or attrition that occurs. Probably the two most important things that happen as we get older is that you get a thinning or loss of the enamel, as well as the tissues surrounding the teeth. Along with that, you can get loss of the bony support of the teeth and ligaments that hold the teeth in as well. There are also certain medications and medical conditions that we run into as we get older that can accelerate, some of these dental problems.
Okay. So as we get older, as far as our home oral care goes, are there things that we should be changing or doing differently to make sure that we're taking care of our gums and our teeth?
Yeah, just like anybody, everybody should be practicing better oral care or, good oral care, but too late to start. You know, I mean, everybody should be brushing at least 2 times a day, using floss on a regular basis. You know, some people like to use toothpicks. That can cause a little bit more damage to the tissue, so I don't like to recommend that as much. Some people enjoy water picks and some of that stuff. You know, some other, you know, avenues there. You know, avoiding certain things like tobacco and sugary things like pop and wine and stuff like that that cause damage to the teeth. Also striving for good nutrition, regular exercise, like more water, good rest, stuff like, you know, and that situation.
Okay. And then what about seeking out professional health care? Should we see a dentist more often, or does any of that care change as we get older?
Yeah, I mean, as we get older, I think you should definitely see a dentist more often than, you know, somebody younger. The visits really depend on your specific dental health. I wouldn't say just your age, and your risk for diseases, and oral disease specifically. You know, the American Dental Association has a recommendation that you should go by what your dentist recommends. Now, there's a specific kind of guideline there. You know, by seeing your dentist on kind of a shorter schedule, you can kind of pick up issues on a, you know, less severe basis. You know, also by seeing your dentist more regularly, you can pick up on maybe some other diseases, you know, that are related to the oral health that might not have been seen before. So
okay,
but I'd say the average recommendation though is about at least twice a year.
Okay,
dentist.
That's good to know. And so something that I think is pretty common, I know I do it from time to time, is grinding your teeth. How does a person know if they're grinding their teeth at night when they're sleeping, and what should they do to prevent that?
Yeah, so I would actually say that most people grind their teeth to some extent, and many people don't realize that they're doing it. Some of the common symptoms, I'd say, as far as people that grind their teeth, are a tightness of the jaw muscles or headaches when they first wake up in the morning. You know, and grinding can be increased in a variety of situations. A lot of, you know, stressful times in our lives, emotional or physical, stress-related chronic pain or anything like that, that can increase the habit. There are also certain types of medications that can increase grinding habits, which a lot of people don't realize. You know, there's also a correlation, and a lot of studies have shown, between grinding and sleep apnea, which is a pretty serious, you know, condition that can lead to some pretty serious health problems. Okay,
and so how can someone prevent that?
Prevent
the grinding. Like
so, yeah, I mean, a lot of the oral appliances that we can make to protect the teeth. Also recognizing emotional or physical triggers like stress and stuff like that, and trying to reduce that in our lives for, you know, whatever habits. Also, like I said, you know, a lot of people don't realize that some of their medications might be increasing that behavior. Maybe, excuse me, sitting down with their primary care physician and maybe adjusting some of those medications as the physician sees fit.
Okay, perfect, thanks. So we do need to pause here for a short break. We're out of time for now, but we are going to come back, and when we do come back, we're going to talk about oral health symptoms we can't ignore as we get older. Stay with us, we'll be right back. Welcome back. We're continuing our discussion with Dr. Daniel Wardell on dental health, and thanks for sticking around with us.
Yeah, no problem.
So there are common issues, as we discussed before the break, that folks can develop with age, and I understand that one of them is dry mouth. Can you talk a little bit about why this happens and what people can do to help with dry mouth?
Yeah, I think it's a great question, because we alluded to before, a lot of people don't realize that dry mouth has, you know, is a big issue as far as dental care, and as we age, you're on more medications that actually can increase that dry mouth. So the most important things that people can do to alleviate the situation, I would say, is trying to stay hydrated, recognizing the medications they're taking that are increasing that, and like I talked about before, maybe potentially adjusting those medications with their physician. There's a lot of a variety of products out there to help with dry mouth, like oral rinses. Sugar-free lozenges are one of my favorite things to recommend to patients. Also, you know, a lot of patients will use sugary substances like sodas and sweets and stuff like that to alleviate, and that actually can make the situation a lot worse as far as the oral care.
Okay, and if someone doesn't do something to try to alleviate that dry mouth, can that lead to worsening symptoms down the road?
Yeah, absolutely. So, you know, your saliva is pretty much your biggest protector of your teeth from dental caries. When that saliva rate decreases, especially at night, because as you sleep, your saliva naturally decreases as well. But the saliva helps protect the teeth by acting as a mineral source, to kind of remineralize the teeth, and also as an antibacterial component. So the issue that we see a lot is that the normal course of dental caries and somebody that has dry mouth is extremely accelerated. So you can get an issue that in a normal person without dry mouth might not take very long time, might blow up a lot quicker.
Okay, good to know. And then another common one I know, especially as we get older, can be gum disease. What is gum disease exactly, and how does somebody know if they have it?
Yeah, so gum disease, basically, it starts out with something we call gingivitis, which is development of plaque around the teeth. The plaque, or that film that develops around the teeth, is actually a collection of bacteria. The body doesn't like that, so it's always trying to get rid of it. So this process of inflammation, which starts as gingivitis, where the gums can be sore, they can bleed easily, stuff like that, brushing and flossing, that can progress, to periodontal disease and stuff like that, where we get, some major problems there.
And so you mentioned periodontal disease, and so again, if it doesn't get cared for, are there other things that people should be concerned about?
Yeah, so the main problem with periodontal disease is that film builds up below the gum line and that inflammation spreads from the gum tissues actually into the bone and the ligaments and the supporting structures of the teeth. As that occurs over time, you get deeper and deeper pockets around those teeth, and you actually get more and more loss of that supporting structure. So you can actually lead to loosening of the teeth, and unfortunately we can't replace bone once it's gone. So you get to a certain extent and you're actually losing teeth that might not otherwise be unhealthy in a way.
Okay, and so that's sort of an unfortunate segue to talk about dentures a little bit, and some of those folks at home who may use them. Any tips or reminders you would give to make sure they're taking good care of those dentures? Yeah,
so what I see from a lot of patients, it's pretty easy to take care of a denture, but the biggest thing is people never take them out. So even after eating, I would recommend take them out briefly, running them under some water, maybe with a little toothbrush, just to clean some of that food debris out. A lot of people also don't realize that you really should be taking your dentures out at night before you go to bed, to definitely give them a good cleaning. But you also want to soak them in water or some sort of denture cleaning solution so they don't warp while you sleep.
Okay. Do our teeth just naturally get looser as we get older?
Not due to age. If a tooth is getting loose, there's some things that can cause that. We talked about periodontal disease, traumatic grinding and stuff like that can cause loosening of the teeth. Unless you're a child, and you're losing a baby tooth or something like that. But if somebody's noticing that their teeth are getting loose, like I said, that there's some underlying cause of that, and they really need to get in to see a dentist and have it checked out.
Okay, and you talked a little bit earlier too about bone loss and how you can't replace that bone once it's lost. Can you talk a little bit more about that? What do folks need to know about bone loss? Yeah, so with bone loss, like I said, you get that inflammation that spreads into the supporting structures of the teeth, and as that bone and ligaments, they get destroyed, there's no way to replace them, so the teeth become loose, and we can't replace that, so you can basically end up needing dentures and other things, even though you're trying to do a job brushing your teeth. Okay. So let's switch and talk a little bit about tobacco. I know you mentioned tobacco and smoking earlier. What can tobacco and chew actually do to your teeth and gums?
So I'd say kind of specifically like staining and unsightly staining or smell of using those types of products. They can also cause issues with gum disease. They can increase gum disease, which leads to periodontal disease, which we've talked about before, which can then lead to bone loss, which then can lead to loss of teeth.
And so we talked about maybe your oral health giving you indications of other things. Can dentists or oral hygienists often notice if there's more going on if somebody smokes?
With smoking, they can notice the kind of the conditions of the gums and stuff like that. The other thing that we are very concerned about with using tobacco products is oral cancer. And so oral cancer can be very hard to detect, and so it's something that can be easily missed by a patient, even if you're really looking in your mouth a lot, or even a normal physician. So it's really important for the trained professional to pick up on that, because it's really important to pick up on that in early stages.
Okay, perfect. Thanks. We do need to pause again. It's time for another break. But up next, we'll talk about the link between oral health and common health conditions and diseases. Stay with us. We'll be right back. We're continuing our discussion with Dr. Daniel Wardell on dental health, and thanks again for giving us such great information. So we've kind of been hinting at that oral health can be an indicator of your overall health, and with diseases like osteoporosis, diabetes, and even heart disease. Can you talk about that a little bit?
Yeah, so I would definitely say that there's a strong correlation between oral health and other diseases, and that's why it makes it very important to keep your oral health as healthy as possible, to reduce the risk of either creating some of these conditions or exacerbating some of the systemic conditions that are already present.
Okay, so what might a person notice in their mouth or their gums or teeth that could be an indication that there's something bigger going on in their body?
Right, and so as you talked about, there's a variety of conditions, like you said, diabetes, osteoporosis, cardiovascular, premature birth weight, stuff like that. Some of the things to be aware of, we kind of alluded to it in past segment, is just making sure that the gums are healthy, that they're not red, bleeding, there's not swelling, there's not, while you're flossing or brushing, and then there are not sores or ulcerations in the mouth.
Okay. And then can a dental X-ray kind of point out some of that stuff and give a doctor like you an indication that there's something bigger going on?
Yeah, so an X-ray is kind of the dentist's most important tool as far as diagnostically. Besides just dental cavities, dental X-rays can identify a variety of things. They can identify abscess or infected teeth, bone loss around potential cancerous areas in the jaw, and some of the other issues. And a lot of people, I get patients fairly regularly that are concerned about the radiation associated with the X-rays. Today's X-rays, most offices are digital, and the radiation is minimal. I would say close to almost wearing like a digital watch or flying, on a commercial airplane. And the value of those X-rays is so great that, worrying about that risk is negligible, I would say.
Yeah, it's worth it to get it done.
Yeah.
So let's talk about heart health a little bit. What's the link between oral health and heart health?
Yeah, so with poor oral health, it creates an environment with high bacterial content. And that bacteria can get into your bloodstream and spread, throughout the rest of the body. And the cardiac area is especially susceptible to that, where the bacteria can actually attach to lining some of the cardiac tissues and cause, inflammation that can lead to some of the major cardiac problems and health, issues.
Okay, and then what about diabetes? Is there something that happens in your mouth that could give it indication, or is there a connection there?
There's definitely a connection between diabetes and oral health. I'd say is kind of the link in and of itself is that diabetes, with poor blood sugar control, makes you more susceptible to infections. And the oral cavity is kind of one of those areas it's very prone to infection, and so that can exacerbate some of the oral conditions. On identifying diabetes in and of itself, it's a little bit difficult. I'd say, as far as some of the things with diabetes, it can cause, if you have a high blood sugar, it can cause like fruity kind of sweet-smelling breath. And also it can lead to the condition of fungal overgrowth we call thrush in the mouth a lot easier.
Okay. And so if someone already knows he or she has diabetes, has been diagnosed, should they pay extra care to their mouth?
I think you touched on it. I think it's just being extra vigilant because more susceptible to the common dental conditions that everybody can kind of deal with. So making sure that you are brushing and flossing as much as possible, that you are seeing the dentist on a regular basis, and some of those things we've already discussed.
Okay. And I know a lot of people have heard the term tooth decay. What exactly is that?
So tooth decay is basically a hole in the tooth caused by bacteria in your mouth that feed off some of the things that you eat. And so then the signs of that are discoloration of that white enamel of the tooth, or actually a hole in that enamel. You can actually get pain and sensitivity, while eating, drinking, in the teeth. Also, some of the biggest concerns when you develop spontaneous pain in your teeth. Or you have, say, swelling or pus or something like that you notice in your mouth.
Okay, and so if someone notices that, the pain or the pus, like you were talking about, how seriously should they take those symptoms?
Yeah, I mean, it's very, I'd say it's serious, and it's one of those things that, it's kind of, I like to say, almost like auto care, going into the mechanic for, the preventive oil change or whatever. Same thing as in dentistry, preventative care, it can save the patient a lot of time and pain and money, whereas if they wait, they could deal with some pretty serious issues.
Okay, so we're about out of time here, but we've talked a little bit about just general oral care. Any closing thoughts or some ideas that you would have to make sure that people are really taking good care of their oral health? Yeah,
and we kind of talked about it before, but brushing on a regular basis, at least twice a day for 2 minutes with a fluoridated toothpaste, especially at night before bedtime, seeing their dentist on a regular basis, and a healthy diet, I would say. Okay, and you said twice a year for when you see your dentist? I think that's the average recommendation, but it really depends on the individual and some of the things we talked about, other medical conditions, or already diagnosed oral problems. Okay, and then just any closing thoughts for people to look out for as they age? What would be your closing advice there? I would just say make sure that they see their dentist on a regular basis. Okay, that's the most useful thing. Yep. Is take advantage of those healthcare professionals. Yep. All right, well, thanks so much, Dr. Wardell. We appreciate your time. And that is going to do it for us again this week. Thank you so much for tuning in. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, and we'll see you next weekend.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.